My name is Emma Ninnis, and I am a clinical nurse specialist. I specialise in treating children and young people with difficult to treat epilepsy at Great Ormond Street Hospital for Children in England. Today I'm going to give you my top advice on how to live a full and active life with epilepsy. There's lots of information and advice about the things to consider in everyday life if you have epilepsy. Whilst trying to find the best way to manage your epilepsy can be overwhelming and worrying, talking about it and making sure others know about the diagnosis can really help. Being open and honest to your family and friends about your epilepsy can be scary. It can also be difficult to describe your epilepsy and may feel daunting and embarrassing telling them. Don't feel ashamed, as everyone around you cares about you and they want to know how your epilepsy affects you so they can understand. They may not be living the same experience as you, although they will want the best for you and will want to help you live a healthy and happy life. It's also helpful to talk about your worries with a healthcare professional. There may be times where you feel isolated and alone living with epilepsy. This is a perfectly normal feeling that most young people with epilepsy experience. There are 60,000 children and young people under the age of 18 years of age in the UK living with epilepsy. That is enough to fill a football stadium. You are definitely not alone. School may also feel frustrating, embarrassing and scary. It's very rare for seizures to affect brain development, but it can disrupt your time at school and cause difficulties with learning, particularly when seizures are not well controlled. There are adjustments that can be made to schoolwork or exams that can be helpful, and additional support may need to be provided. There will be others at school with epilepsy, and there may be local support groups to help. How can others help? Family, friends, teachers, and everyone around you may be worried that they may not know how to help you during a seizure. Reassure everyone that most seizures stop within 5 minutes and that their role is to ensure that you are safe. Ask them to try their best to stay calm and that they should stay with you and call out for help. They should remember the time of when the seizure started. They should cushion your head to protect it and move any objects out of the way to keep your space safe. They should not try to restrict any movements or put anything in your mouth. You will have an individual emergency care plan, so there is a plan of what to do depending on the scenario. This will need to be followed by a trained adult or the emergency services for a prolonged seizure. Coping with difficult days. Epilepsy is more than just seizures. It is normal for you to feel exhausted, have a headache, feel dizzy or sick after the seizure, and you may need to sleep and rest. You may also be concerned or worried about having another one. Try to remember the seizure you have experienced on a particular day is just part of what you have experienced on that day, and it is not your fault. Take a few minutes to be alone, to accept what has happened and accept that it was beyond your control. You can think about what you may say and advise a friend who was going through a similar situation and try to allow yourself this same treatment. It's likely that you would be sympathetic, kind, and give them time to talk about their experience. It can be helpful to think about the times that you have coped well before and what made you feel better in the past. It can also help to take part in gentle activities after you have rested, such as reading or listening to music or talking with friends. Socialising with friends and family is a good medicine for your health and well-being, and you should plan in case you have a seizure. This includes having a buddy with you that knows to call for help if you were to have a seizure, wearing an identity bracelet or necklace. If you have an aura or just not feeling right during any activity, tell someone in case a seizure is coming, and avoid potential triggers for seizures, such as stress, anxiety, lack of sleep, skipping medications, illness, alcohol and drugs. Everyday life can be more challenging, but you can live a full and active life, and professionals like me can help guide to find the most effective management options. Remember that you are the only person in control of your own life, so be kind to yourself and do what is best for you. you.